Hello, our topic for today is cognitive behavioral therapy by William Pengda and Ojosvi. So, cognitive behavior therapy. What is cognitive behavior therapy? Behavioral and cognitive therapies, or CBT, bring together a set of treatments for psychiatric disorders that share an approach according to which therapy must be based on knowledge from scientific psychology. Cognitive psychology involves the study of internal mental processes, all of the things that go on inside your brain, including perception, thinking, memory, attention, language, problem solving, and learning. The father of cognitive psychology. Known as the father of cognitive psychology, Nasser revolutionized this discipline by challenging behaviorist theory and endeavoring to discover how the mind thinks and works. He was particularly interested in memory and perception. So, how is cognitive psychology used today? Cognitive psychology is very useful and popular because it can be applied to many fields in psychology, which includes memory, attention, perception, child development, problem solving, eyewitness testimony, and gender role development. They study thinking, perception, decision making, memory, and judgment. The cognitive approach in psychology is a relatively modern approach to human behavior that focuses on how we think. It assumes that our thought processes affect the way in which we behave. Some of the examples of cognitive psychology are: our ability to reason through logic is a prime example of cognition. Making a judgment about something based on the information you receive that your brain processes. Learning is an example of cognition. Our ability to solve problems has to do with cognitive brain functions.
So, I came up with the types of cognitive behavioral therapy. We know that there are many types of cognitive behavioral therapy, but I came up with just four that I think will be very helpful for all of us, and we can easily get access to it. So, the first one is detecting problem, which during the session with the psychologist, you are required to open and remove all of what is in your mind and even in your heart. And for the surely the patient should be not worried and afraid to say everything he has, like every worry he has, because the psychology will be able to detect the problem and help him. So I come up with the second one, which is music therapy. Music therapy, like I will talk of me, like music therapy helped me. I don't call it a therapy, but music helped me when I am stressed and all of that. And in this case, music therapy is often used as a tool for excellent therapy. Not only for voices that are very pleasant and soothing, but music is very often done therapy in order to cure a person from various problems. And we, whenever we listen to music, we feel good after. So the third one is counseling problem, counseling therapy. Use for this one may have been familiar because for counseling therapy is always used as a way of healing various abnormalities and psychological problems. So for the last one, rehabilitation therapy, this one is something that we always see in the sport industry. because whenever for example, a football player, whenever he get injured or anything like that, there is always a therapy to follow his rehabilitation in order to get back to work. So the rehabilitation therapy can be done for those who already have a fairly accurate psychological disorder, and this way can be used as one of quite effective way. So I came up with these four pictures representing the four type of cognitive behavioral therapy I thought about before. So the first one is detecting problem. The psychologist detect the problem, and the patient has to say everything. As you can see, she feel pain. Maybe she had some difficult problem, and you can see by the facial expression of the psychologist that she's ready to help, and she's just doing her work. So for the second one is music therapy, which you can see the lady is laid out there with her headphones, and you can see from her face that the music she's listening to maybe working. So for the third one, she's with a group of people telling a problem, and everybody is ready to help her. So the last one, as I said, the sport player had an injury, and for a certain time, he has to be followed by a doctor who is specialized in that, and he, he will help him for the rehabilitation process.
So I'm gonna talk about the medical uses of CBT. And the CBT is used to treat many kinds of disorders, such as depression and anxiety disorders and bipolar disorder. So for the depression, CBT is used to reduce symptoms of depression as an independent treatment or in combination with medications to modify the underlying schemas or beliefs that maintain the depression, to address various psychosocial problems, for example, the marital discord, job stress, which can contribute to the symptoms, reduce the chances of recurrence, and increase the adherence to recommended medical treatment. So for the anxiety disorders, the CBT can identify the negative thought, to challenge the negative thought, and finally replace the negative thought with the realistic one. So it has a exposure therapy during the CBT to treat the anxiety disorders. So the basic idea of exposure therapy is to face your fears. When someone exposes themselves to the source of their anxieties and nothing bad happens, and the first step of exposure therapy is to create a fear hierarchy. The goal is for the patients to be exposed to stimulate that are only moderately anxiety producing, while using relaxation skills to manage their response. So finally, the patients can move on to the more challenging situations that they identified it in the fear hierarchy. The next one is bipolar disorder. So there are basically 6 steps for the CBT to treat the bipolar disorder. And the first one is accepting your diagnosis. And the first step is to understand and acknowledge that patients have a disorder that's responsible for the symptoms. The second one is monitoring your mood. And this is often done using a worksheet or journal, which is kept up on a daily basis between sessions and then reviewed with the therapist. And third one is undergoing cognitive restructuring. This process focuses on correcting flawed thought patterns by learning how to become more aware of the role thoughts play in patients' mood, how to identify problematic thoughts, and how to change or correct them. The fourth one is problem solving frequently. And this step involves learning how to identify a problem, generate potential solutions, select the solution, try it, and evaluate the outcome. And the final one is enhancing your social skills. Some people with the bipolar disorder lack certain social skills, which causes them to feel that they aren't in control of a certain aspect of their lives. And learning skills such as assertiveness can help patients to manage interpersonal relationships better. So, the conclusion, I think all humans are flawed, and there is not a single human alive that doesn't have cognitive distortion from time to time. Developing a deeper understanding of what these distortions are and creating a way to reframe thoughts, behaviors, and actions can help all humans.
Ooh. Hey,
Well,
William, how's it
hey
going?
Eric. Hey, I'm good. I'm good. And you?
Everything's okay in the quarantine?
Yeah. Yeah, how are you doing in the quarantine?
Well, just chill, relax in home.
Yeah.
No big deal. Nothing
Yeah.
to do. It's kind of
Yeah.
stuff. Yeah,
Just eating, sleeping, walking. It's the
that's it.
routine, right?
Yeah, that's
Yeah.
it.
Hello, guys.
Hello,
Hi,
doctor.
hi,
So,
doctor.
welcome to our group counseling session. So, tell me, how are you feeling today, Eric and William?
Well, I think my depression is getting worse, but and I also have feelings of helpless and despair.
So for my part, my anxiety has gotten worse. I have many thoughts that occupy my mind, mostly negative thoughts.
So, Eric and William, could you be more specific?
Well, for me, I am stressed about my exam. I failed an important exam, and I'm really very depressed. And I was planning to propose to my girlfriend, but with all this stress, I seem cannot to focus on that.
I can see that you have a lot going and you have many responsibilities.
Exactly.
So for myself, I feel like I cannot focus on anything. Like I am nervous when I'm in public, and especially when I am around crowds. And I even every day when I go back home, I lock my door and read a book in my bed. And sometimes I even double check my lock if I had forgotten to lock it or not. So I feel more secure in my apartment alone.
Yes, I can tell that you have been thinking a lot about it and your thoughts are worrying a lot.
Yeah. Well, and also I think it's too much for me. I've lost 14 pounds without dieting, and also have trouble falling asleep at night. And almost every night I suffer from nightmares and woke up at 3 a.m. several mornings a week. Yeah,
Yes, I can understand what you
it's
have been
terrible.
going through. Yes, so that's why we are here, right?
Yeah,
Yes. Yeah.
exactly.
So thank you for coming here today and telling me your problems. So here at this clinic, we will use the cognitive behavioral method. And I have, so here, William,
Yes.
here, Eric.
Yes.
So these are the lists to check if you have some beliefs that you are operating with. So Eric, could you start with yours first?
Well, I would say number one, the which says loss of interest in things you used to enjoy.
Yeah, and for me, I would say number 4, which says feeling nervous, restless, or tense.
Yes, I can notice from what you have told me earlier. So let me be clear about this counseling session, which we will go under the CBT method. So in this group counseling, we will look at your behaviors, your feelings, and your thoughts to see how they affect each other and how they affect you. So also, CBT works on changing your thought patterns and on modifying behaviors in the immediate present. So for each group sessions, our goals will be set out clearly. So I will also be giving you individual homeworks regarding both of your issues. And
Yes.
I'm sure that with time and dedication, this will allow you to remain healthy for many years to come. So let us begin our session.
Okay.
Well done with a cheese at. Hey, big flex, believe that. My friends got my back.
Well, thank you, doctor. Thank you for your advices. Thanks.
Thank you.
Appreciate that.
Thank you, doctor. I think I'll try to change and say what you taught me.
Yes, I hope you guys finish your homework and let me know if you have any problems. You can always call me. And yes, thank you so much for coming today. So I will see
Yeah,
you in our
sure.
next session and take
All
care,
right.
woman. See
All
you.
right. See
See
you
you.
then, doctor.
See you.